Good evening, everyone. Myself, Dr. Sunil Kumar Gothwal, and I am Associate Professor in Department of Medicine in JLN Medical College, Ajmer. Uh, uh, Today, we are discussing about hypertension and what does it mean to have hypertension. Each time when the heart beats, it pumps into the blood vessels that create a pressure against the wall in the blood vessels. This is called as blood pressure. Normally, in a healthy person, people uh, blood pressure rise and fall throughout the day. But when the blood pressure remain high for longer time, this is called as hypertension. The normal blood pressure is a huge range, but what we called as normal, it is 120 by the 80. 120 is systolic blood pressure, whereas 80 is the diastolic blood pressure. Blood pressure more than 140 systolic and 90 diastolic for a longer time is called as hypertension. What causes hypertension and who is at risk? The main issue of our topic is what causes hypertension. Several factors are responsible for developing hypertension, and it is usually divided into the two groups, broad two groups. One is called as modifiable risk factors, and another is called as non-modifiable risk factors. So we have to focus on the what are the modifiable risk factors. Modifiable risk factors means we can modify those risk factors so we can reduce the chances of development of the hypertension. So what are those? One is sedentary lifestyle and not getting enough physical activity, excess alcohol intake regularly, eating junk food and fatty foods, smoking tobacco, obesity and overweight, and constantly under stressful work condition or stressful lifestyle. So now that comes the what are the signs and symptoms of the high blood pressure. Actually, high blood pressure develop over time. Most of the time, there are no obvious sign or symptoms. You may not know that you have it. So it put the people risk for several diseases from heart problems to eye damage and blindness. That is why it is often called as silent killer. However, uh, what are the main symptoms that include morning headache or tiredness, visual disturbance or vision changes, buzzing in the ear, fatigue, nausea or vomiting? If a person experiences some of these symptoms, then one should get their blood pressure checked. Then comes the how to protect your heart from high blood pressure. So hypertension, as you all know, what are the modifiable risk factors? So hypertension can also be prevented and reduced by taking steps towards a healthier lifestyle, such as eat well balanced diet that include the low in salt, limit your alcohol intake, enjoy regular physical activity that should be at least 150 minute per week or 30 minutes 5 times in a day in a week. Enjoy regular physical activity, manage stress by the exercise or yoga, whatever you want to do. Maintain healthy weight by exercise, doing routine exercise and healthy diet. Quit smoking, take your medication properly. In fact, if blood pressure is successfully controlled with healthy lifestyle, then it might avoid delay or reduce need for medication. High blood pressure can be controlled in many ways. Keeping blood pressure in normal range, it is very important in preventing cardiovascular complications such as heart attack and uh, angina or whatever. It is very much possible to maintain normal blood pressure level with regular monitoring and preventive care. That is all about hypertension. Thank you.